my name's Lisa Rose and I'm one of the community midwives, and we've been asked to do a short video on the third stage of birth. So the third stage of birth is the birth of the placenta, the thing that's been keeping your baby alive throughout the whole time, and obviously after you've birthed the baby, the placenta then has to follow behind. So what will have hopefully happened when you've given birth to your baby is you will have been having some lovely skin to skin time with your baby, and we would have been allowing that cord to keep pulsating and do delayed cord clamping after giving birth to the baby. So when that cord has stopped pulsating, you can feel the blood sort of flowing through it. And when that has stopped and the cord has just gone silent, we then generally would clamp the cord at this point, and allow dad or birth partner, whoever you have with you at the time, or ourselves to cut the cord at this stage. It would have allowed the baby to have got as much blood back from the placenta as possible, keep the baby as healthy and happy as possible, but when it stops, generally we can clamp and cut the cord at that point. We don't actually have to clamp and cut the cord at any time. We can birth the placenta without having clamped and cut the cord, but the standard practice nowadays is when that cord stops pulsating, or if it's been at least a minute and we need to try and encourage the birth of the placenta a bit quicker, then after a minute we would clamp and then cut. Once we've clamped and cut the cord, we have two options of a way to birth the placenta. So you can allow your body to do it naturally and allow your natural hormones to sort of expel the placenta. So this can happen, it could take up to an hour, but on average is about sort of 20-30 minutes for your body to do this, and this is where your body was designed to birth the placenta. There's no real intervention from us. We just wait until you start feeling those sort of crampy pains again, those tightenings come back, and then you push your placenta out. It doesn't take as much effort as birthing a baby at all. It's a lot shorter and there's no bones in it, so it doesn't hurt as it's coming out, but there is a little bit more maternal effort involved than the active option, in terms of you have to just push a little bit yourself. We definitely encourage the physiological stage of birth of the placenta nowadays, because it's one less injection for mum, and if you've got no risk factors, then it's just nice to leave you be and allow your body to just get on with it itself. Or you have the option of the active third stage, and that's when we give you an injection of an artificial hormone which helps to clamp down, contract your uterus and expel your placenta a lot quicker. If you have the injection after giving birth and after we've clamped the cord, then normally your placenta is born within about 10 minutes of having had that injection, because it's a strong sort of jolt of this artificial hormone, which just causes your uterus to just go clamp down and push the placenta out. In this sort of instance, we would wait for that clamping to happen, wait for signs that the placenta is starting to come away from inside, which could be a bit of a brisk blood loss. We would feel your uterus to make sure it's nice and tight, and then we would guard sort of to make sure that everything stays in place. We would put our hand on just above your pubic bone, and then we would pull out the placenta. So that generally happens within about 10 minutes of having the injection. There are some cases where we would encourage you to have the active third stage, and that's if you're high risk, generally consultant-led care, you've ever had any bleeding in your pregnancy, or bleeding immediately post-birth of baby, or if you've had a very long latent labour in general, and your body's just exhausted. Sometimes your own body doesn't have the energy to contract that uterus quite so well, so you have a slightly increased risk of bleeding. So if that's happening, we may encourage you to have the injection to help birth the placenta, but otherwise we are quite happy to facilitate a physiological birth as well. So you have those two options, and then after the placenta's born, you have the option to have a little look at your placenta, take the placenta home. I mean, it's your property, or we can dispose of the placenta for you if that's what you wish.